is one of the reasons because you feel, Dr. Krishna, we were talking about this earlier, that the virus, in the way it's manifesting itself in India, both in terms of infectivity and in terms of fatality, doesn't require that huge kind of response that we have to throw everything into now just the COVID vaccine at the neglect of other, our ongoing healthcare interventions?
So if you look at the figures per se over the course of the epidemic, we are at about 100 per million fatality rates compared, say, to the West, which is at about 1,000 per million. Right. So there's a baseline difference across. The vulnerability groups are also quite different. But if you look at something like Karnataka, the fatality rates in the last 10 days have been about between 10 to 20 for a population of 70 million. So that boils down to about 1 per 5 million per day. So clearly you have to focus on health workers, you have to focus on older people, you have to focus on vulnerable groups, but a mass strategy is pointless and a herd immunity strategy would work very well. I also agree with Dr. Paul in focusing on mRNA apart from infective, the classical sort of Bharat Biotech kind of route, because mRNA vaccines or DNA vaccines would allow you to leapfrog to the next generation of technologies where you can make single protein expressions. And I think this is an inflection point that we should utilize.
Okay.
Where I would expand on what Dr. Paul said was he talked about the standard routine immunization. I would say that we should also now expand immunization to papilloma viruses, oncogenic cervical cancers, expand the hepatitis vaccination. And this is an opportunity to do that, and we must grab it.